name is Brandy Banks, and this is my critical analysis or critical assignment. I will be presenting on a comprehensive analysis of type 2 diabetes mellitus, focusing on its pathophysiology, health consequences, prevention strategies, and broader public health implications. Diabetes is often discussed simply as a blood sugar problem, but in reality, it is a complex, systematic disease that affects nearly every organ system and places enormous strains on individuals, families, and healthcare systems. Throughout this presentation, I will examine how the disease develops, why it is so prevalent, and what evidence-based strategies exist to improve outcome. I will also emphasize the importance of screening, education, and prevention because type 2 diabetes is largely preventable, and my goal is not only to explain the science behind the condition, but also to demonstrate how health professionals and public health initiatives can reduce disparities, empower communities to live, and empower communities to live healthier lives. Now I'll be going over my background and rationale behind why I chose this topic. I selected type 2 diabetes for this project because it has affected my life personally because of family members who have succumbed to this disease. From a public health perspective, it is one of the fastest growing chronic diseases worldwide and presents as a leading cause of preventable illness and death. From a personal standpoint, this disease has directly affected my own family, and has contributed to the loss of several relatives. Seeing how diabetes impact their lives, their quality of life, made me realize how devastating yet preventable this disease can be. That personal experience, or not personal, but I think it helps me better understand the science behind the disease because of my personal experience through my family, and how I can explore the education to help give my loved ones early interventions or tips for early intervention. Choosing this topic allows me to connect clinical knowledge and real world impact. It also highlights how lifestyle behavior, community resources, and health education play essential roles in determining long-term outcomes. Type 2 diabetes is not just an individual problem, it's a global epidemic. According to the World Health Organization, more than 22 million people worldwide are currently living with diabetes, and those numbers continue to rise every year. In the United States alone, the Center for Disease Control and Prevention estimate that over 38 million Americans have diabetes, with 90 to 95% of those cases being type 2 diabetes. These statistics demonstrate the magnitude of the issue. What is particularly concerning is that many people remain undiagnosed for years, allowing complications to develop silently. The rapid increase in prevalence is highly linked to modern lifestyle patterns, including sedentary behavior and poor nutrition. These trends indicate that without effective prevention strategies, diabetes will continue to place a growing burden on both individuals and healthcare systems. At the individual level, type 2 diabetes significantly affect daily life and overall health. Chronic hypoglycemia damages blood vessels and nerves throughout the body, which leads to complications such as retinopathy, neuropathy, and cardiovascular disease. Patients often experience fatigue, frequent infections, and slow wound healing, which reduces their ability to work and participate in normal activities. Emotionally, the constant management of medication, glucose checks, and dietary restrictions can contribute to stress, anxiety, and depression. From a broader perspective, diabetes is one of the leading causes of blindness, kidney failure, and non-traumatic amputation. The outcome demonstrates that diabetes is not simply a manageable inconvenience, but a serious life-altering disease. Understanding these impacts underscore why prevention and early treatment is so critical for protecting quality of life. Beyond its clinical effects, diabetes creates a tremendous burden or economic burden. Healthcare system spends billions of dollars each year treating complications such as dialysis, cardiovascular surgeries, hospitalization, and long-term medication use. Lost productivity from missed work days and disabilities further increase the financial strain. It's also important that I mention that this burden is not distributed equally. Lower income population and racial and economic or ethnic minorities often experience higher rates of diabetes due to limited access to healthy foods, safe exercise environments, and consistent health care. These disparities mean that diabetes is also a social justice issue. Addressing the disease requires not only medical treatment but also systematic changes that improve access to prevention resources. Reducing costs and disparities ultimately benefit both individuals and the entire healthcare system. The development of type 2 diabetes is multifactorial, meaning it results from a combination of genetics, behavioral, and environmental influences. Some risk factors, such as age, family, history, and ethnicity, cannot be changed. However, many contributors are modifiable. Obesity, particularly excess visceral fat, plays a central role in interfering with insulin signaling. Physical inactivity reduces the body's ability to use glucose effectively, while diets high in refined carbohydrates and saturated fats worsen insulin resistance. Social determinants of health also matter greatly. Limited food access, lower income, and reduced healthcare availability increases risks. Recognizing that both biological and environmental factors contribute to diabetes help us design prevention strategies that address not only individual choices but also community conditions. Excuse me. Understanding the pathophysiology of diabetes begins with normal glucose regulation. Under healthy conditions, the pancreas releases insulin in response to raising blood sugar. Insulin allows glucose to enter cells where it is used for energy, maintaining stable blood glucose levels, and maintaining blood glucose levels or stable glucose levels. In type 2 diabetes, this process becomes impaired. Initially, the body tissues such as muscles and fat become resistant to insulin. As a result, glucose remains in the bloodstream instead of entering the cell. The pancreas compensates by producing more insulin, but over time, the beta cells become exhausted and insulin production declines. This combination of insulin resistance and reduced secretion leads to persistent hypoglycemia. Chronic high blood pressure triggers oxidative stress, inflammation, and tissue damage. This processes injure small and large blood vessels, explaining why patients develop complications affecting the eyes, kidneys, heart, and nerves. Essentially, diabetes is a vascular disease caused by prolonged metabolic imbalance. Recognizing these mechanisms help explain both symptoms and complications. Many individuals with type 2 diabetes experience few symptoms initially, which is why the disease often goes undetected. When symptoms appear, they typically include a classic triad of polyuria, polydipsia, and polyphagia, meaning frequent urination, excessive thirst, and increased hunger. Patients may also report fatigue, blurred vision, slow wound healing, and recurrent infection. Peripheral neuropathy can cause tingling or numbness in the hands and feet. Acanthosis nigricans, which appears as darkened skin folds, may signal underlying insulin resistance. Because these symptoms develop gradually, many people may not seek medical care until complications are already present. This delayed recognition reinforces the importance of routine screening and awareness. Screening plays a crucial role in preventing complications. Diagnostic testing or diagnostic tools include hemoglobin A1C testing, fasting plasma glucose, and oral glucose tolerance test. These methods help identify both diabetes and prediabetes. Early detection allows healthcare providers to initiate initial or interventions before serious damage can occur. Adults over 35 years old and younger individuals with high risk should be regularly screened. Community-based screenings in workplaces, schools, and clinics can reach those who may not otherwise seek care. Identifying high-risk individuals early creates an opportunities to implement lifestyle modifications that can delay or even prevent the disease from progressing. Management of type 2 diabetes combines lifestyle changes with medication therapy, dietary improvement, increased physical activity, and weight reduction remain the first line of treatment. When medication is needed, metformin is typically prescribed first because it improves insulin sensitivity and lowers glucose production. Additional therapies may include GLP-1 receptor agonists, or insulin. The American Diabetes Association provides evidence-based guidelines for individualized treatments. These therapies work best when paired with consistent self-monitoring and education. Advances in technology continue to improve diabetes management. Continuous glucose monitors allow real-time tracking of blood sugar trends. Insulin pumps and automated delivery systems provide more precise control. Telehealth and digital health tools support remote monitoring and patient education. Research into precise medication and combination therapies may further enhance outcomes. These innovations show promise for improvement in adherence and reducing complications. To improve recognition, screening must extend beyond traditional clinical settings. Community health fairs, mobile clinics, and workplace wellness programs increase accessibility. Partnering with trusted community organizations can reduce barriers and encourage participation. Integrating education with screening ensures that individuals understand their results and next steps. Education is one of the most powerful prevention tools. Programs such as the National Diabetes Program or Prevention Program have shown that structured lifestyle coaching can reduce disease progression by up to 58%. Teaching nutrition, exercise, and self management skills empower individuals to control their own health. Although many resources exist, gaps remain. Primary care providers, dietitians, and support groups offer variable services. However, underserved communities often lack access to culturally appropriate education, affordable healthy food, and safe places to exercise. Expanding these resources is critical for equity. My recommendations include expanding screening programs, increasing prevention funding, integrating health education into schools and workplaces, and addressing social determinants of health through policy change. Diabetes management strongly aligns with public health principles including surveillance, health promotion, policy development, and community engagement. In conclusion, type 2 diabetes is a serious but largely preventable disease. Through early detection, education, and equitable public health strategies, we can significantly reduce the burden and reduce or improve quality of life. Thank you so much.